There are indications that your kidneys require some attention today. Now is the time to pay attention, particularly if you have diabetes or are overweight, before it is too late. I'm Dr. Ergin. I'm an endocrinologist and a diabetes specialist. Now, kidneys are referred to as the filters of our body, right? Now, toxins that are not properly eliminated might lead to serious issues in your body. Well, I have previously stated that only a small percentage of people who have chronic renal disease are aware of their condition. Most of them don't. Now, this is mainly due to the fact that early indications of renal disease can be mistaken for those other disorders. As a result, in this video, I will talk about how to avoid kidney problems and how to treat them as promptly as possible. Now, first symptom is tiredness. Who is not tired, right? Listen up. Even though tiredness is the most prevalent symptom, it is important to check your kidneys if you have not been feeling tired in the recent years or months and it has suddenly resurfaced. In the event that our kidneys are not functioning properly, our blood may become quote-unquote polluted. Because of that, we may feel weary, weak, disoriented, and unable to concentrate for long periods of time. Now, secondly, anemia is a symptom of chronic renal disease or chronic kidney disease that is severe. We become fatigued and susceptible when our red blood cells are depleted as a result of a reduction in oxygen distribution throughout our body. Now, kidneys play an essential role in that. Also, despite the fact that the surroundings is hot, you may be feeling chilled when you're anemic. Anemia makes you feel really cold even while everyone else is comfortable. It is also important to have your kidneys assessed if you're anemic, because this also could be an indication of kidney problems that may be underdiagnosed or undiagnosed, or maybe misattributed to something else that may be causing the anemia. So if your primary symptoms are exhaustion and feeling cold, you might also consider having your thyroid checked. So seeing an endocrinologist sometimes has its benefits, right? Now, appreciative of what you have heard so far, if you like and subscribe to our YouTube channel, we will really appreciate that, and you will not miss any of our new educational videos. Now, the following 3 signs that I'm going to talk about is about decreased water and protein excretion, okay? Now, shortness of breath is the third one. Now, kidney disease can also be a source of breathing problems. Now, how is that? Well, because kidney problems are commonly coupled with heart and lung problems. Because one of the kidney's primary job is to eliminate excess water from our body. Now, as a result, your heart will have difficulty pumping if there's too much fluid and blood that will back up into your lungs, and it will make it difficult for you to breathe. Now, do you understand the connection between kidneys all the way to the lungs? Well, it has the potential to cause and actually aggravate the heart failure as well, and we know type 2 diabetics are very high risk for heart failure. Now, you may have an ankle and foot swelling, a hand swelling, that's the fourth sign. And because of the kidney failure, you will collect a large amount of salt and water in your body. Now, legs, ankles, feet, and hands get swollen as a result of that. But in contrast to that, the lymphedema could be an indication of liver, heart, and vascular conditions as well. So don't jump to the conclusion that you have a kidney failure, but get it checked. Now, the fifth symptom is puffiness around your eyes. When your kidneys are compromised, protein seeps into your urine, causing facial puffiness and blotchy skin. Your face, your feet, your ankles, and hands will all get bigger in size as a result of that. Now, it is best to consult with a doctor if you see any of these signs and symptoms, because they could be an evidence of another illness other than kidney dysfunction as well, although most commonly it happens due to kidney dysfunction. Now, number 6 is dry and itchy skin. Now, why is that? Well, in addition to filtering impurities and helping create red blood cells, our kidneys are also responsible for ensuring that our bodies have the right amount of minerals. Now, the presence of dry, itchy skin signals that your kidneys are failing to maintain the mineral balance in your body. Remember, skin reactions might be caused by meds as well. So don't ignore these signs, look at your medications, get your kidneys checked. Now, symptom number 7 is bad breath with a metallic aftertaste. That's probably the most disgusting one. The taste of your food may be metallic if you suffer from kidney failure. Now, you may also have had a case of bad breath from other things as well, but most of the time when you have kidney disease, you also have low appetite. What we call uremia, often known as toxemia, is the source of all these symptoms. It is possible to experience nausea and vomiting at this time as well. So even the mere thought of food can actually make you feel sick. Number 8, problems with urinating, especially urinating too often or too little. Now, you may be experiencing kidney failure if you are waking up in the middle of the night to go to the bathroom, especially if it is more than once. Now, a decrease in urine production may also happen at a later stage. The fact that it may be presence of acute or late-stage kidney disease if you have very little urine left. Now, the 9th one is you may have a foamy consistency in your urine. The cause of foamy urine vary from forceful urination to dehydration. It can also be a symptom of kidney disease. Now, kidneys filter proteins, right, from the blood, and they reabsorb. Now, these proteins help keep the body's fluid in equilibrium or in balance. Now, some studies suggest that kidney impairment or kidney disease might actually cause protein leakage into the urine. It's nothing new. And albumin is one of them. It's a blood protein. A healthy kidney normally does not allow a substantial amount of this protein going to your urine. But when you have a damaged kidney, that may happen. We call this proteinuria or albuminuria. That is indicated typically, by looking at it, it can be frothy urine, in the first sight. It can be a sign of kidney disease. So you need to get your protein in the urine checked, especially if you're diabetic, every 3 to 6 months. Now, number 10 is insomnia, not able to sleep. Again, that could be a sign of kidney disease. Now, how is that? The chemicals that remain in your bloodstream for a long period of time because they are not filtered well because of the kidney dysfunction, what will happen is it will be tough to sleep and rest throughout this period because of all the toxins running in your system that's keeping you awake. It also has been linked to obstructive sleep apnea. So sleep apnea is another condition which can actually make your breathing worse. It can even make you stop breathing. And kidney failure can make the sleep apnea worse. Now, as a result, your wife can be telling you or your husband can be telling you that you're snoring so loud and you're stopping breathing, etc. Well, these conditions are more common in people with kidney disease as well, so be alert. So I hope this really helped you understand some of the concerning signs of possible kidney disease. Don't panic, just get it checked. If you have more than one sign that we talked about, please make sure you talk to your doctor. Getting your kidney tested at least every 3 to 6 months by your endocrinologist or your primary care doctor will be especially important, and it's a good way to prevent kidney disease. We have another video that talks about a new medication that actually helps prevent or reduce the progression of proteinuria or albuminuria. It's called Kerendia. It's relatively new, and this video is made in April 2022. So it's still a relatively new medication, but it is really helpful. I have seen myself, the patient's protein in the urine is coming down within 3 months rapidly. So I believe in that medication. So you can check that out. It's called Kerendia, and we have a video about that. Also, some natural things you can do, like benfotiamine, like alpha-lipoic acid, things like that can actually prevent any diabetes complication. And for that, we have a SugarMD neuropathy support that most of you are already using happily. It can help the neuropathy quite a bit, but it can also help prevent kidney disease as well. So, I hope this video helped you. If so, please like, subscribe, and guess what? We'll see you again in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.